You might want to make an effort to lose weight or stay fit, but do you ever check out the trainers you work with? How qualified are they? Tonight, the troubleshooters are getting answers.
A popular workout has really opened our eyes to exactly who runs the health and fitness industry and what that means for you.
Here's NBC Connecticut Chief Investigative Reporter Len Bestoff.
Ask Ian Montalvo about CrossFit stigma and he'll tell you firsthand. He's heard it all.
It's been called a cult. It's been called, the crazy people workouts.
Ian chose the high-intensity sport because it was the only thing that worked after a bad motorcycle accident left him inactive and 75 pounds overweight.
It was just a bit of a mental barrier to get over from being so physical than to be incapable of using any of your physical abilities.
Ian admits he was more injury prone than ever when he started the sport, so in order to shed those pounds and get his strength back, he had to do it right. But some of us learn that the hard way.
So that's where this impinges right here.
Dr. Cory Edgar is with UConn Health, and he sees more and more patients getting hurt from CrossFit.
Shoulder injuries in particular, injuries that occur from poor mechanics.
The recipe for these injuries is pretty simple. Dr. Edgar says if you're trying to beat the clock while lifting heavy weights, your form is the first thing that's going to go once you get fatigued. And if your trainer, CrossFit or otherwise, doesn't correct your technique, you have a really good chance of getting injured.
Just gonna go easy, 10 jumping jacks.
So having a trainer who knows what they're doing is key. Seems simple enough, right? The troubleshooters want to find out what it takes to be a personal trainer. As it turns out, it doesn't take much. Connecticut, along with the vast majority of the country, does not regulate its health and fitness industry. So someone could become a personal trainer without having any certifications or experience whatsoever.
We encourage all our coaches to keep learning, so we give them a certain amount of money each year to actually get more certifications.
Owner Brendan Marolda requires all of his coaches to have the basic Level 1 certification through CrossFit, plus a 6-month internship. But fitness professionals disagree on how much education is enough. Wayne Nadeau owns a personal training studio in Newington, and he says certified trainers usually go through programs accredited by the National Commission for Certifying Agencies. The program gives students material to study, followed by a test.
It's typically about 8 months.
CrossFit offers different levels of certification. Its Level 1 certificate, which gives you CrossFit trainer designation, also involves a test, but takes just 2 days.
There's so many different things that you need to learn about the body and how it functions. To just learn that over, let's say, 48 hours, I just don't see how that can happen.
Just remember, kettlebell swing is more of a hip extension movement.
But Marolda insists the time you spend behind textbooks doesn't necessarily translate to how successful you'll be in the gym.
Kind of a field where the weak people weed themselves out. So if you're not good at what you do, if you don't try to get better at it, people will quickly see that.
So if you're using a trainer, don't hesitate to ask what certifications they have or what injuries they see in their gym. Back and shoulder injuries suggest bad form, which might mean they aren't picking up on certain movements.
People really lose their form, one, when they get tired, as you mentioned, and two, when they're trying to get out of their envelope of functioning. So showing off usually necessitates injury, and I think slow and steady is really the way to go about it.
With the NBC Connecticut Troubleshooters, I'm Len Bestoff.
And while Connecticut hasn't made any moves toward regulating the health and fitness industry, a bill was recently proposed in Massachusetts that will require certification for all personal trainers. So far, Washington, D.C. is the only U.S. jurisdiction to have that requirement.